Good afternoon, everyone, and welcome. My name is Laurie Campbell, and I'm the Executive Director of the Metastatic Breast Cancer Alliance. On behalf of the Alliance, I'd like to welcome you to today's educational webinar titled Hereditary Breast Cancer and Genetic Testing, collaboration with Pfizer's Story Half Told. Before we get started, I would like to cover a few housekeeping items. Today's webinar is scheduled to run for 1 hour. The first 45 minutes will be a PowerPoint presentation, which will be followed by a 15-minute Q&A session. Please use the Q&A box at the lower middle of your screen to enter any questions as we go along. We're going to take questions at the end, and we'll only be fielding questions that are put into the Q&A. Please do not use the chat box. A recording of today's webinar will be available starting Monday on the Metastatic Breast Cancer Alliance YouTube channel. With that, I'd like to thank you, and at this time, I'd like to turn the program over to Shirley Mertz, the chair of the Metastatic Breast Cancer Alliance.
Thank you, Laurie. I would like to add my welcome to all of you who took time today to join us for what I believe will be a very informative webinar on hereditary breast cancer and genetic testing. The Alliance certainly appreciates the collaboration with Pfizer on this webinar, and in particular, we want to thank Beth Burnett, who is Director of Patient Advocacy and Professional Relations, who is on the call. And also on the call is Lauren Ashka of Cantor, the company that worked on the survey, and Lauren will be available to answer any survey-specific questions later in the presentation. So now I am pleased to introduce our speaker, Dr. Lily Aruda, who is Medical Director, U.S. Medical Affairs at Pfizer Oncology. Dr. Aruda obtained her PhD in molecular biology at Vanderbilt University after completing a Bachelor of Science in Chemistry at Furman University. She pursued her postdoctoral degree at Fox Chase Cancer Center in Philadelphia, where her research focused on the design and testing of genetically engineered antibodies to target breast cancer. Since then, Dr. Aruda has spent the last 16 years building expertise in oncology in the pharmaceutical industry setting, and in particular, she has held roles within both the research and development and medical affairs sector, which have allowed her to build and apply her medical knowledge across the oncology drug development process. So with that, we welcome you, Dr. Aruda, and look forward to your presentation.
Thank you for inviting me, Shirley, and welcome everyone. And as Shirley mentioned, today I'm going to discuss with you the results of a breast cancer patient survey on hereditary breast cancer and genetic testing that was conducted as part of Pfizer's Breast Cancer, A Story Half Told. Next slide, please. Thank you. So in 2014, Pfizer launched Breast Cancer, A Story Half Told to uncover misperceptions and spotlight real-life stories of people living with metastatic breast cancer. But as the patient stories told us, everyone living with metastatic breast cancer is not the same. So in order to continue advancing the metastatic breast cancer dialogue, today we are shedding light on specific aspects of living with metastatic breast cancer that remain untold, including hereditary breast cancer and the importance of genetic testing. In an effort to foster progress for this patient population, Pfizer conducted research to better understand the challenges that patients whose disease can be attributed to inherited genetic mutations face, as well as gaps in knowledge about genetic testing. And then through these efforts, we hope to increase awareness about hereditary breast cancer and knowledge about the importance of genetic testing. Next slide, please. So this slide shows our agenda for today. I'll start out by presenting the background and rationale, as well as the design and methodology of the survey. And then I'll take a deeper dive into the results and key insights, focusing on our 3 survey objectives, which included understanding and awareness, barriers to testing, and emotional impact and need for support. I will then close by providing overarching takeaways and insights based on the survey data, and also provide information on how the survey results, along with other research conducted via Story Half Told, were leveraged to inform Story Half Told hereditary breast cancer and genetic testing resources. So just to provide some background on Story Half Told first, Pfizer first developed Breast Cancer, A Story Half Told in 2014 to help raise awareness of metastatic breast cancer in a new and compelling way by highlighting the complex needs of these patients. Story Half Told was developed in partnership with a multidisciplinary steering committee comprised of patient advocates, HCPs, linguists, and employers. Our initiative was comprised of 3 phases. The first phase focused on evaluating the language of metastatic breast cancer, as language is important to the way we connect, process, and explain our world. To help inform our goals, we conducted 2 complementary studies. The first was a survey to measure the general public's understanding of breast cancer, and the second was an ethnographic study analyzing real-life conversations that were occurring between patients and HCPs after diagnosis. The second phase aimed to understand the state of metastatic breast cancer in the workplace. To help inform our goals with this initiative, we conducted a multi-perspective study. This study was implemented in partnership with Cancer and Careers, which is an advocacy organization dedicated to providing support for people with cancer who are trying to manage the disease while having a career. The third phase aimed to address the lack of understanding uncovered by our research through the perspectives of women and men living with metastatic breast cancer. Well-known photographers partnered with Pfizer to capture the daily lives of people living with metastatic breast cancer. We also launched a Share Community Stories tab, where anyone impacted by metastatic breast cancer can share their experiences or words of inspiration on the Story Half Told Facebook page. We know that while all patients with metastatic breast cancer face a complex and difficult journey, those whose disease can be attributed to inherited genetic mutations face unique challenges. And as we learn more about the biology of breast cancer, it becomes clear that we need to address the needs of this community, especially since it is currently estimated that only 15% of all eligible patients with metastatic breast cancer undergo genetic testing to determine if their cancer is hereditary. So in order to address some of those needs and challenges that exist, Pfizer conducted a survey of breast cancer patients to gain a better understanding of the issues these patients face and their perceptions around genetic testing. So we'll first discuss the objectives and methodology of the survey. There were 3 primary objectives of the survey. First, to assess current understanding of hereditary breast cancer and genetic testing among patients with breast cancer. Second, to uncover the barriers to getting genetic testing among patients with breast cancer. And then third, to determine emotional implications, availability of resources, and unmet needs among patients with hereditary breast cancer. So the survey was facilitated by our Story Half Told advocacy partners who distributed the survey to individuals who opted into their email distribution list. Respondents received compensation, which was a $20 gift card for completing the survey. And here you can see the breakdown of the various advocacy partners that participated. So we had a really good turnout. 1,001 patients participated over a 4-day period from June 28th through July 1st, 2018, which was well over our original goal, which was 200 respondents. All of the respondents were screened to ensure they were 18 years of age or older, living in the United States, and had been diagnosed with breast cancer, and it could have been any stage of breast cancer. So one important note I want to mention as I review the results is that it is important to remember that these findings are representative of the advocacy organizations who distributed the survey. Because these respondents may be more knowledgeable than typical patients, caution should be used in interpreting these survey results. So let's start by taking a closer look at the respondent demographics. Most respondents, or 78%, were between the ages of 35 and 59 with an average age of 49. The vast majority of patients, or 97%, who took the survey were female, and most respondents, or 69%, self-identified as white or Caucasian. 50% of the patients identified their location as suburban, while 38% identified their location as urban. When we look specifically at the breast cancer demographics among the respondents, they reported nearly half, or 49%, had metastatic breast cancer. This is likely due to many patients receiving the survey through the Metastatic Breast Cancer Network, which was one of the first groups to distribute the survey. As anticipated, a majority, or 60% of respondents, were treated by an oncologist, and a majority of respondents reported a family history of cancer, with breast cancer being the most cited at 44%. So now I'll turn to the detailed results of the survey, beginning with the findings on understanding and awareness of hereditary breast cancer and genetic testing. So the survey found that an opportunity exists to educate breast cancer patients about hereditary breast cancer and the importance of genetic testing. While most respondents were familiar with hereditary breast cancer, only about 50% realized that a gene can be inherited from both parents. A majority of the 1,001 respondents also claimed to be knowledgeable about genetic testing, and most respondents were also familiar with BRCA mutation. More specifically, 64% of respondents said that they either know a great deal or know some things about genetic testing. Respondents were then provided with 10 mutations and asked to rate their familiarity with each on a 4-point scale, where 1 equaled don't know anything and 4 equaled know a great deal. A majority of patients, or 74%, said they either know a great deal or know some things about BRCA mutations. When asked about other genetic mutations, that number dropped to around 1/3 of patients, between 27 and 35%, who indicated that they had knowledge of each of the other 9 mutations referenced. So despite high levels of reported familiarity with BRCA, the survey found that misconceptions about BRCA were prevalent. Both charts on this slide look at the responses of only the patients who answered they either know a great deal or know some things about genetic testing. And what we found was that the majority of respondents were not aware of the percentage of people with an inherited BRCA gene who will actually develop breast cancer. Respondents reported that 50% or below of individuals who inherit an abnormal BRCA gene will get breast cancer at some point, when in fact, approximately 70% of these individuals will. In addition, most respondents believe that the statement, all BRCA mutations are inherited, is true, when in reality, some BRCA mutations are somatic, meaning they are caused by the environment or other factors, and are not passed down by a parent to their child or children. In the next section, respondents were then asked about their specific experiences with genetic testing, the reasons for getting testing, and the barriers to testing that they faced. So when we looked at testing rates at the majority of respondents, approximately 70%, reported they received genetic testing. Only 22% reported they had not been tested, and 8% weren't certain if they were tested or not. When asked hypothetically why they believed individuals would receive genetic testing, 70% of respondents said to see if they were at risk for breast cancer, and 61% said to better manage their breast cancer. What's interesting is the metastatic breast cancer patients were more likely than early stage 1 or 2 breast cancer patients to cite to inform family history or to identify treatment options. When asked hypothetically when they believe genetic testing should occur, the majority of respondents, or 47%, said hereditary testing should occur at any time. And then the next most common response was only after a breast cancer diagnosis, at 33%. In the subset of respondents that originally stated they had been tested for hereditary breast cancer, which was 696 patients, most were tested post-diagnosis and received testing because of family risk concerns. 60% of those that reported undergoing genetic testing did so after diagnosis, while 23% did so after their breast cancer either came back or spread. 16% of respondents were tested before they were diagnosed. I just want to note here that there were 5 responders who answered, "I've never been tested," after previously answering that they had been. So it's possible that those survey participants misunderstood the original question or inadvertently selected, "I have never been tested." 59% of those that reported being tested or undergoing genetic testing received genetic testing out of concern about hereditary risk for their children or siblings. 52% answered that they were tested due to their doctor's recommendation to do so, and 37% of respondents stated that they were tested to see how they could better manage their disease. Interestingly, those who stated they do not have hereditary breast cancer knowledge were more likely to be tested per physician recommendation. Of the 22% of respondents who were not tested for hereditary breast cancer, which was 224 patients, 34 patients reported that they were told they were not appropriate patients for genetic testing. The remaining respondents who were not tested, which was 190 patients, cited a lack of recommendation as the most common reason for not doing so, followed by cost and insurance coverage concerns. So now we'll move on to the last section of the survey, which was specific to respondents who reported they had been diagnosed with hereditary breast cancer. This section analyzed the emotional impact of their diagnosis and assessed needs for support and resources. So 297 of the total survey respondents, which as you recall was 1,001 patients, self-reported as having been diagnosed with hereditary breast cancer. We want to pause here to note that these diagnoses were not confirmed by Pfizer or the advocacy organizations and are solely based on survey responses. Most of these respondents said they were receiving good emotional support from their support networks. And in particular, the survey found that African Americans and Asians had higher levels of support. More specifically, 86% of those who identified as Black or African American and 91% of those who identified as Asian said they have an excellent or a good amount of support. This is compared to 60% of those who identified as white or Caucasian and 50% who identified as Hispanic or Latino who said the same. So these next few slides outline respondent answers to a series of 11 emotional implication statements. The answers were based on a 5-point scale where 1 equals strongly disagree and 5 equals strongly agree. Neutral answers where respondents chose neither agree nor disagree were not included on this slide. Overall, the majority of respondents with hereditary breast cancer agreed that the emotional implications of their diagnosis are significant, particularly when it concerns their children, not so surprisingly. 84% of patients agreed with the statement, "I'm worried that my children will get cancer because they may have inherited this genetic mutation from me." The majority of responders with hereditary breast cancer also agreed that they worry that their diagnosis will harm family relationships or place a burden on family and friends. So 63% of patients agreed with the statement, I'm worried that sharing that my breast cancer is hereditary with family members may damage our relations, while 70% agreed that my breast cancer puts a lot of burden on my friends and family to help support me. While most of these respondents agreed that it's important their children are tested for genetic mutations, they were unsure how to approach the conversation. So 66% of patients said it's important that my children get genetic testing to see if they are at risk for hereditary cancer. However, 68% agreed that I don't know how to tell my children or siblings I have a genetic mutation that may increase their own risk of cancer. Furthermore, 58% of respondents agreed that I tried to share information on my hereditary breast cancer with my family, but I was met with resistance. So we also inquired about the usefulness of particular support services. While most patients with hereditary breast cancer, or 70%, said they were satisfied with available support services, no single resource stood out as particularly helpful, demonstrating that there may be an opportunity to provide better emotional support. More specifically, 48% of patients said they found online resources for hereditary breast cancer helpful, and 34% found online peer support groups helpful. Metastatic breast cancer patients were more likely than early or locally advanced patients to report that family and friends were helpful. In regards to learning about hereditary breast cancer, 69% of respondents who self-identified as being diagnosed with hereditary breast cancer stated they were satisfied with available educational resources. However, again, no single resource really rose to the top. Similar to emotional resources, online information was viewed as most helpful to learning about hereditary breast cancer. And metastatic patients were more likely than early or locally advanced patients to report that genetic counselors were helpful. Next slide, please. So based on the entirety of this data, the following top-line conclusions can be drawn. Next slide. First, education is needed to address the common misperceptions around hereditary breast cancer and genetic testing. While the majority of survey responders labeled themselves as knowledgeable about both hereditary breast cancer and genetic testing, 46% did not realize that genetic mutations can be inherited from both parents, and 81% were not aware of the percentage of people with an inherited BRCA gene who will actually develop breast cancer. Next slide, please. Secondly, multiple barriers to genetic testing and unmet emotional needs of patients with hereditary breast cancer exist. The largest barriers to receiving genetic testing were that respondents were not aware that it could be done, how to go about being tested, or it was not recommended by their healthcare provider. So this is definitely an area that needs to be addressed. Additionally, the emotional burden of hereditary breast cancer is clear. And the survey showed that patients particularly worried that their children will get cancer because they have inherited a genetic mutation. And then finally, although responders said they were satisfied with services and resources available for support and education, they could not identify a specific resource that was particularly helpful. Next slide, please. Now let's talk about how these results informed our story half told activities. Based on the challenges and barriers identified in the survey, as well as insight gathered from a multidisciplinary roundtable of experts comprised of genetic counselors, psychologists, oncologists, nurse navigators, and advocacy group leaders, some of whom are patients themselves, a series of strategic recommendations for the breast cancer community were issued via an addendum to the original Story Half Told Statement of Need. These recommendations aim to identify and address the barriers that prevent patients with metastatic breast cancer from getting tested and the information gaps that may exist. So the first recommendation is to empower patients with metastatic breast cancer by dispelling myths, addressing confusion, and providing education to increase knowledge about hereditary breast cancer and normalize genetic testing for appropriate patients. Some methods to accomplish this include tailored materials that simplify the language around hereditary breast cancer and genetic testing, as well as providing information about the importance of genetic testing after diagnosis, while guiding patients to organizations with unique experience in this area. In addition, of course, it's important that patients speak to their physicians about whether they are appropriate for genetic testing and how to go about getting genetic testing if they are. The second recommendation is to reframe patient-physician discussions around genetic testing to be more empowering and actionable based on the latest research. One way to do this includes leveraging existing resources to develop new training tools for healthcare professionals to help facilitate shared decision-making and genetic testing discussions in an emotionally supportive manner. And then the third recommendation is to increase access to genetic testing and resources for patients with metastatic breast cancer. This can be done by integrating genetic testing as routine care for metastatic breast cancer, including training members of the healthcare team on critical issues such as testing referrals, obtaining informed consent, and discussing results. So the detailed Statement of Need addendum is available on storyhalftold.com, and hard copies are available if you're interested in receiving them. The research that was conducted has already led to the following Story Half Told outputs, which were developed as part of the addition of hereditary breast cancer and genetic testing to the program. So first, a Statement of Need addendum was issued outlining the 3 strategic recommendations as we just discussed. Secondly, a new Story Half Told hereditary metastatic breast cancer patient, Tara, was introduced to the program to highlight the unique experiences of these patients. And then thirdly, genetic testing resources were added to storyhalftold.com, and new educational materials such as the hereditary breast cancer infographic were developed. So if you're interested in learning more about the survey results and the resources developed, please visit storyhalftold.com. And at this point, I want to thank you for your time, and I think we have time for a few questions.
Great, thank you very much. There are a few questions. Some were submitted as part of the registration, so I'll just select those for you. And the first one is, do you feel that men with a breast or prostate family history should be tested?
So the recommendation would be that they should speak to their physician about their family history and have their HCP evaluate whether they are eligible for testing.
Okay, next question is how young should kids be tested if their mother has breast cancer?
Yeah, so again, this is going to be very specific to the patient and their family and the age of their children. And again, my recommendation would be to have that discussion likely not only with their physician, but also with a genetic counselor, and they can really provide that guidance as well as resources and materials to have those discussions with their children.
Great, thank you. The next question, Dr. Ruda, comes in from Julia. For MBC patients with BRCA mutations that are responding to treatment and NED or NEAD, what is the surgery recommendation?
Yes, so again, I think that they should have that discussion with their oncologist, who again knows their specific history and case and would be able to make an appropriate recommendation.
Yeah, it looks like a lot of the questions are kind of specific that maybe would be best discussed with their HCP.
Yes.
There is one general one here. Could you have a germline mutation, i.e. in all your cells, but have generated this yourself, not inherited it from one of your parents?
So yes, it is possible that you can have a germline mutation. So if you already have the germline mutation, but then you can develop somatic mutations in other parts of the gene as well. That is correct.
This is Shirley. I'm not sure that was the question from Julia. She was focusing, could you develop a germline mutation, but yourself, and not have gotten it from either your mother or your father?
Oh, okay. Yes. No, yes, that is possible, and that there can be, again, the development of germline mutation, sort of a patient zero, can occur. That is correct, but that's very infrequent. But yes, that's possible.
That is amazing. I have not heard of that before, and I guess the implication would be is if that showed up in a test and you as the patient developed that germline, then how significant is that for your children if you're trying to inform them of what their risks are? I mean, how would you know whether this is in part of its germline versus you just created it yourself and you haven't yet? Would you pass that on to your children then?
So yeah, so once it's determined to be germline, and that would need to be determined by a blood test versus just looking at the tumor sample. Once it's determined to be germline, it is inheritable then at that point.
Okay. Another question that has come up when I have interacted with patients is patients will say two things. One, I asked my doctor if I should have be tested, and the doctor was not so enthusiastic about it. So what do I do then?
I mean, again, this is a conversation that they would need to have with their physician. If the physician has a very specific rationale as to why they are not a candidate, then, they would have to either trust that opinion or go and get a second opinion to confirm with another physician that, they are indeed not appropriate for testing.
One other thing that often comes up is how does a patient find out about whether genetic testing would be covered in their insurance? Some, especially in the metastatic setting where there are such expensive treatments, we experience financial toxicity. And so is there some way maybe that an organization could define, does Medicare cover this, or under what conditions? If you're a Medicaid patient, can you be covered? Does private insurance cover it? Not. And then if you have no insurance, what do you do? I think the practical side of genetic testing is very important for the patients going forward to understand.
Yes, absolutely. I completely agree. And I know this is a concern of many patients. And I would say that they should, work with their insurance companies and the office staff at their physician's office to help them understand what would be covered in their plan and what wouldn't, and what the cost would be if it would not be.
Another helpful suggestion from Lisa Schlager is that metastatic patients can ask for a consultation with the genetic counselor if their physician is not supportive, and that genetic counselors are also a good resource that can help with insurance coverage. I wanted to circle back to one of the earlier questions about at what age is appropriate for children to be tested. And again, there's a comment from Lisa that her recommendation is that testing should only be done for individuals 18 or older. Obviously, it's a personal family thing that would need to be discussed, but that's a suggestion from one of the participants. Any other questions at this point? Checking, I think we've answered everything in the Q&A box.
Lori, could I just make a comment? I really appreciate that Lisa Schlager shared information. And I would encourage any of the listeners on this webinar to look at the Force Facing Our Risk Empowered website. They have excellent information there, and they work very hard to try to bring about policies that are helpful to patients.
Yeah. I have one last question, just maybe for Beth, and that's, there are a number of participants on the call today are from the nonprofit community, and do you have any suggestions or recommendations for folks that really care about this issue of how they could get involved and have an impact?
So I think that there's, Lily mentioned the opportunity to share your story on Story Half Told. If there are materials or things that you find to be useful, you can share those with us, and we can potentially have those included. We have information that you can utilize in education, like the infographic, as well as links to organizations that have an expertise in genetic testing and hereditary breast cancer. So, those would be just a couple of ways. If anyone is interested and would like a copy of the addendum, you can let Dana and Lori know, and we can have some sent to you. So I think that there's a couple of different ways for folks to be involved. So thank you.
Great, thanks, Beth. There's one last question from Lisa. What are the gene mutations beyond BRCA1 and 2 which are next in line regarding indicators of increased breast cancer risk?
Yeah, so I don't know, Beth, are you able to go back to that slide? Let me see if I can pull up which slide it is. As part of this survey, slide 13.
Yeah, I think you had a list of the top 12, I believe.
Yeah, I'm trying. Let me just see if my computer keeps getting stuck. Sorry.
And while she's pulling that up, I'll just speak to it a bit. So, we know that ATM mutations as well as CHEK2 and PALB2 are kind of some of the more common ones after BRCA mutations. I think you had it there. And again, they're identifying new mutations all the time, but currently, yes, thank you. You can see this list here, and keep in mind, these percentages are around patient understanding of the various genes or knowledge of these various genes. These are not prevalence or anything like that, but it gives you a sense of some of the other genes that have been linked to breast cancer.
Great. I think there are a couple of participants that would be happy to get involved to share their information in Story Half Told, and we'll make sure that they have the relevant link to do just that. Any other final questions? Okay then, on behalf of the Metastatic Breast Cancer Alliance, I would like to thank everyone who participated in today's webinar, especially Dr. Lily Arudo, our guest speaker, and a final shout out to Beth Burnett and the Pfizer Story Half Told for their continued support of the metastatic breast cancer community and the Alliance. Thank you very much, everybody, for attending, and we will send a follow-up with a YouTube link for the recorded webinar, which will be available on Monday. Thank you. Bye-bye.
Thank you.